Hello, my name is Paul Flynn and welcome to episode 8. This is the second of 2 episodes aimed at dealing with strategies to tackle chronic pain. Now, as stated in the last episode, we moved away from why pain persists and started to look at what we can actually do about it. We went through the main approaches outlined by the NICE guidelines and how they fit in with everything we've discussed earlier in the series. In this episode, we're going to build on that, because while those areas are the core of current guidance, they don't cover everything that can influence how pain behaves over time. So today we're going to look at 3 additional areas. 1 is sleep, 2 is pacing, and 3 is the role of the clinician themselves. And much like the last episode, the theme here is not one single solution. It's how different factors, each on their own relatively small, can start to influence how the system behaves when you put them together. Because if pain is influenced by sensitivity and by how the body responds to it over time, then these are 3 areas that can play a role in shaping that. And we're going to start with sleep. So again, let's jump right in. Because sleep is one of those areas that most people know is important, but it's often not clear why, particularly in relation to pain, I want to discuss a little bit first about what sleep actually is and how it works. Some of you may know this because there is a lot of information out there on it at the moment, but I want to break it down a wee bit for just people who don't. So when we look at sleep, it isn't just a period where the body switches off. It's an active process that runs in cycles throughout the night. So each cycle lasts roughly 90 minutes, and across the night you'll move through several of these cycles, one after the other. And each time you sleep, you don't drop straight into deep sleep. You move through these different stages. You start in what's called a light sleep. And this is the phase where you're drifting off. Your breathing slows down, your muscles begin to relax, and your body starts to shift out of being fully awake. It's quite easy at this stage to wake up, and you pass through it multiple times during the night, not just at the start. Now, as sleep deepens, you move into what we call deep sleep. And this is the stage where the body really settles into its deepest levels of rest. So your heart rate drops, your breathing becomes slower and more steady, and you become much less aware of what's going on around you. And it is much harder to wake someone at this point because the body is properly switched into rest mode. And this is where the deep sleep really matters. It's the stage most closely linked with physical restoration. So this is when the body's recovery processes are most active, including the release of hormones that help with repair and keeping things functioning properly, basically. So although you're unconscious and not aware of any of this happening, deep sleep is not a passive state. A lot is still going on in the background, and it plays a key role in how the body resets physically from one day to the next. Then later in the cycle, you move to your REM sleep, or REM, which stands for rapid eye movement sleep. Now this stage is quite different, so even though you're still asleep, the brain becomes much more active again, almost closer to how it is when you're awake. And this is also the stage where most of your dreaming tends to happen. So REM sleep is more closely linked with how the brain processes information. It's associated with memory, learning, and making sense of what's happened during the day. And also seems to play a role in emotional regulation, so helping the brain process stress, experiences, and information so things don't build up over time. So whilst deep sleep is more about the body settling and recovering, REM sleep is more about the brain organising, processing and resetting in its own way. And again, this isn't something you're aware of while it's happening, but it plays an important role in how you feel and function the next day, not just physically, but mentally as well. And over the course of the night, you move through all these stages again and again, cycling between lighter sleep, deeper sleep and REM sleep. So when we talk about a good night's sleep, it's not just about how long you're in bed, it's about how well these cycles run and how much time you spend moving through each one of those stages. So across a normal night's sleep, you would usually expect to go through around 4 to 6 of these cycles, depending on your total sleep time, which at 90 minutes per cycle, for most people works out roughly 6 to 9 hours of sleep. Now, when all of that is working well, sleep supports a wide range of functions in the body. Now, we've already talked about physical restoration and how the body resets during deeper stages of sleep, but it goes beyond that. Because sleep is closely linked with how the immune system functions. So people who consistently get poor sleep are more likely to become unwell, and recover from illness can be slower. It also plays a role in how the body regulates things like energy levels, hormones, and general day-to-day function. And then on the other side of that, there's the effect on the brain. So sleep is strongly linked with concentration, memory, and decision-making and a mood. Most people recognise that after a poor night's sleep, things feel a bit slower, a bit harder, and a bit more difficult to deal with. And alcohol is a really good example of how this can be disrupted. So while it can make you feel more relaxed or help you fall asleep initially, it tends to lead to more broken, lower quality sleep through the night, which is why people often feel less rested the next day. So when you step back and look at it, sleep isn't just one small part of health. It underpins a lot of how the body and brain function from one day to the next. And that naturally leads to the next question. If sleep plays such an important role in how the body regulates itself, where does it fit in with pain? Because when we look at people with ongoing persistent pain, one of the most consistent patterns we see is the disruption of sleep. So difficulty getting to sleep, waking through the night, or sleep that doesn't feel restorative, like you're fresh the next day. And for many people, this becomes a cycle. Pain makes it harder to sleep, and poor sleep then seems to make the pain feel worse the next day. Now, that doesn't necessarily mean that poor sleep is causing pain itself, but it does suggest that sleep may influence how that pain is experienced. And this is where it links back to what we discussed earlier in the series, particularly in episode 3. If pain is influenced by how sensitive the system is, then anything that leaves the system more alert or more reactive or less settled can start to matter. So when sleep is disrupted, the brain tends to become more responsive to signals, including pain. So the same signal can feel stronger or stand out more than it normally would. At the same time, the body becomes less effective at dampening those signals down. So it's not just that more is coming in, it's that less is being filtered out. Sleep also affects mood and stress levels. So after a poor night's sleep, people tend to feel more on edge, more irritable, and less able to deal with day-to-day stress. And that can change how pain is interpreted. So instead of just noticing it and getting on with your day, it can start to hold your attention more. You might find yourself thinking more about it, checking it more, and reacting to it more. And things that you would normally brush off can start to feel like a bit of a problem. And once that shift happens, it becomes much harder to just ignore pain or move past it. Now again, this doesn't mean that poor sleep is the cause of persistent pain, but it does suggest that there's a link between the two. That poor sleep may be one of the factors that keeps the system more sensitive over time, particularly when we consider that poor sleep is a major feature in chronic pain patients. And if this is the case, it raises an important point. If sleep can influence how reactive the system is, then improving sleep, even slightly, may help reduce that level of sensitivity. Not as a fix, but again as part of the bigger picture. And that's where we move into the next part. If sleep matters, what actually affects it? And what can we do to improve it? And what actually helps? And as with everything, there's no single fix. But when we again try to apply science, there are a number of factors that are consistently linked with better quality sleep. The first and probably most important is consistency. So going to bed roughly at the same time each night and waking at roughly the same time each morning, because sleep is heavily influenced by routine. The body runs on something called their circadian rhythm, essentially an internal clock that helps regulate when you feel awake and when you feel ready to sleep. Now this clock responds strongly to patterns, so when the sleep times are consistent, it becomes easier for the body to anticipate sleep and settle into it. But when sleep times are all over the place, later nights, lie-ins, irregular routines, that rhythm becomes harder to maintain and falling asleep can become more unpredictable. And keeping that pattern as consistent as possible, even across weekends, tends to make it easier to fall asleep and stay awake. Now, light also plays a big role in this as well. So during the day, exposure to natural light helps set that internal clock. But in the evening, the body relies on the reduction in light to start preparing for sleep. And this is where melatonin comes in. Because melatonin is a hormone that helps signal to the body that it's time to sleep. It naturally starts to rise in the evening as the light levels basically start to drop. But exposure to bright light, particularly from screens like phones, tablets and TVs, can delay that rise in melatonin. So while someone might feel tired, their body's been given mixed signals, which can make it harder to fall asleep at the time they intended to. So reducing screen use or lowering brightness in the hour or two before bed can help that process happen more naturally. Now, I know it is a cliche when it's spoken about leaving your phone out of the bedroom or avoiding it for an hour before bed, but there is clear science behind it, and we need to be honest. If you struggle to sleep but spend the last 30 minutes in bed on your phone or tablet, this may well be contributing in some way to your problems. Now, caffeine is another one to be aware of. Caffeine is a stimulant. It works by keeping the brain more alert and blocking sub-signals that make you feel sleepy. So even if you feel like you can fall asleep after having it, it doesn't necessarily mean it's not having an effect. And it's not just found in coffee. A standard cup of tea still contains a noticeable amount of caffeine. And if someone is having several cups across the afternoon or evening, that can start to build up. And the other thing to be aware of is how long it stays in your system. So caffeine can remain active for several hours after you've had it. So something taken later in the day can still be affecting you into the evening and overnight. And this is where it links back to what we discussed earlier. You might still fall asleep, but the quality of that sleep can be affected. It can make sleep lighter, more broken, and reduce time spent in the deeper stages of sleep, which are important for physical recovery. So reducing caffeine later in the day can make a difference, not just in falling asleep, but how settled and restorative the actual sleep is. And then there's the sleep environment itself. So a room that is cooler, darker and quieter tends to support better sleep. Now we've already touched on light and how it affects the body's internal clock. So keeping the room dark helps avoid disrupting that. Temperature also plays a role. So the body naturally drops its core temperature as it prepares for sleep. So a cooler room tends to support that process. If the room is too warm, it can make it harder to settle and easier to wake during the night. And noise is also a factor. So even if it doesn't fully wake you, background noise can pull you out of the deeper stages of sleep into lighter sleep, which affects how settled and restorative that sleep feels. So even small things like light coming through the curtains, noise in the background, or the room being too warm can influence how easily someone falls asleep and how well they stay asleep throughout the night. Now, I'm sure none of these solutions to a better sleep are particularly enticing. So no screens, no caffeine, no noise, and a slightly cooler room. But we have to go with the evidence. And when we are dealing with something as complex as chronic pain, we need to tackle it from multiple angles. And this nicely leads us into our next section, and that's pacing. So first of all, I suppose, what is pacing? Pacing is essentially about how you spend your activity across a day or the week. It's not about doing less, it's about doing things in a more consistent and controlled way rather than having big ups and downs. Because one of the common patterns we see with ongoing pain is what's often called the boom or bust cycle. So on a good day, someone feels a bit better, so they do a bit more. They catch up on things that they've been putting off, push a bit further, and maybe take advantage of feeling less restricted. But then later that day or the next day, things flare up. Pain increases, movement becomes harder, and they have to pull right back again. So the pattern becomes a good day, you do more, you flare up, you do less, and you repeat. And over time, that lack of consistency can keep things unsettled. And we've discussed in earlier episodes, when those flare-ups happen, it's very easy to start linking activity with pain. So activity goes up, pain increases, and the natural response is to become more cautious or avoid certain movements. And this feeds into the same cycle we've spoken about across episodes. So pacing is about trying to break that cycle. Instead of doing as much as you can on a good day, it's about doing an amount that you can repeat, even on a slightly worse day. So activity becomes more even, more predictable, and less up and down. So pacing is really about creating consistency. It's about finding a level of activity that you can repeat, rather than pushing on good days and paying for it afterwards. And over time, that consistency can help settle the system. And a simple example of this might be walking. So if someone knows they can manage 15 minutes walking on a slightly worse day, then that becomes their baseline. Not 30 minutes on a good day, not pushing until it flares, just a level that feels manageable and repeatable. And from there, they might increase it slowly, a minute at a time, maybe every week or a couple of weeks. So there's no big jumps, there's no big spikes, and no major setbacks. Just a steady trend in the right direction. And that's really the aim, not to restrict activity, but to build it back up gradually and in a way that the system can keep up with. Which links directly back to what we discussed in the last episode with regards movement and setting aims that may be very modest, just basic movements, but aims that progress in a way that doesn't overexcite the system. And this is a key feature of pacing. And in reality, we see this in the clinic all the time. People indicating that they did something more than a norm, and as a result their pain flared. And the danger of this and the importance of pacing is then how they perceive it. Because if they perceive that the body has limitations and that if they do too much it's bad for them, they are less likely to repeat the activity. If on the contrary they recognise that it was simply a case that they did more than the nervous system sensitivity would allow at the time, and in fact nothing further was damaged or broken, and if we were to scan that painful area before and after the activity, it would look the exact same both times with no changes, then that changes their outlook. Because many patients fear increasing their activity because of past flare-ups, and they are far more comfortable staying at the current level of activity and pain rather than risk progressing. But pacing is a technique to try and counter that. Small, steady changes that the nervous system barely registers. And this leads to a broader point about patient interpretation. Because after all we've discussed so far in the episodes, we're trying to reach a point where patients gain autonomy over their own symptoms and an ability to rationalise, to some extent, what is happening in their own body. So if we consider what we've discussed in terms of chronic pain as an oversensitivity of the system, imagine a scenario where you wake up in the morning and your chronic back pain is significantly worse than normal. And this isn't unusual, and it happens at times throughout your life. You might generally associate it with having done too much activity and previously assumed that this is meant that you have done further damage or that the problem that was there is now getting worse. But after this podcast and after listening to it, you start to reevaluate things differently. You might first ask yourself, did I do something significantly more physically active than normal? And if the answer is yes, then you use all we have spoken about to rationalise that. While that may be the reason, it does not mean that there's been further damage. But what if you weren't more active the day before? Where do you go from there? Well, given all we've discussed about hypersensitivity, you might start to ask yourself a few more questions. Did you, for example, have a poor night's sleep? Did you have a row with your spouse? Are you under financial pressure? Or do you have a meeting or an appointment coming up that you're dreading? Or is there something else outside of physical factors that could explain increased stress, anxiety, or a change in mood? Because what we've learned is that all of these factors can influence how pain is experienced. And being able to recognise that and put a name to it can go a long way in reducing the anxiety around the pain, giving clarity on what might actually be contributing to it, and handing back some control, basically by being able to explain it. And you can start to see how all of this starts to tie together. Why the education part comes first, then the plan, and then the implementation. Because without understanding, the next steps become almost impossible to apply. Now, one final point as we draw towards the end of this series. A lot of what we've discussed isn't just important for people living with pain, it's just as important for the people trying to help them. Because pain is not always easy to interpret, especially when scans or tests don't give clear answers. And this is where things can start to become difficult. Now, we know from research that when there isn't clear medical evidence, for example, a scan that shows a definite cause, pain can sometimes be taken less seriously, even unintentionally. Not because clinicians don't care, but because the usual medical model is built around identifying a clear problem and treating it. And when that doesn't happen, the explanation becomes less certain. And that uncertainty matters. Because as we've discussed throughout episodes in the series, particularly in episode 2 and 6, the way pain is explained can shape how it behaves. So if someone is told your scan is normal, that might sound really reassuring from a clinician point of view, but from the patient's side, it often doesn't land the same way. It can sound like there's nothing wrong, it doesn't make sense, or we don't know what to do next, or we have no answer. And when pain is still very real, that can be confusing at best and frustrating or worrying at worst. And the same applies to some of the language that's commonly used. So phrases, as we discussed before, like wear and tear, degeneration, it's age-related, your disc is out, your core is weak, your spine is unstable. These are often used to try and explain things simply, but they can be taken very literally. And once the idea is in place, it doesn't just stay as a thought, it starts to change how people move day to day. So they hesitate, they avoid things that they used to do without thinking, and they stop trusting their body's capabilities. And that's not a small thing, because as we've already seen, how pain is understood feeds directly into how the system behaves. There's also good evidence that what a clinician understands about pain affects the advice they give. So the explanation someone hears isn't just coming from a scan or the assessment, it's coming from the person sitting in front of them. So take the example, someone's told that their back is worn out or that there's degeneration on the scan. From a clinical point of view, that might be a way of describing common age-related changes, but most people don't hear it that way. They hear that something is damaged, it needs protected, and they need to be careful. So they start moving differently, avoiding certain things, second guessing what they can do and can't do. But compare that now to someone who's told these changes are common. They don't always relate to pain and your back is still strong. That tends to land very differently, and it gives people permission to move, to use their back, and to get on with things without constantly thinking something's wrong. And over time, that usually leads to a very different outcome. But there's also research showing that when pain doesn't show up clearly on a scan or a test, it tends to be taken less seriously by the clinician. So in experimental studies, when the same pain was presented with and without clear medical evidence, it's rated as less severe and less believable when there isn't a visible cause. So even within healthcare, pain that doesn't fit a clear structural picture can be harder to interpret and easier to dismiss. And this creates a problem because the person still has the pain, but they're left without a clear explanation of what's actually going on or what to do about it. So the context provided by a clinician is very important, and the evidence in the area points to this, and for the need for clinicians to be very careful with their language. They must understand that patients pick up on their language, their tone, their delivery and their explanation. And clinicians in musculoskeletal pain must understand the limits of scans, understand that a normal scan does not mean nothing is happening or that pain is normal, and being aware that how something is explained can have a lasting effect. And this isn't about getting everything perfect or expecting every clinician to have the same level of expertise in chronic pain. That's not realistic. But it does highlight the importance of clinicians knowing the guidelines, understanding when pain doesn't fit a simple structural or medical model, and being willing to approach it differently when it happens. Because in these situations, the kind of which we've spent the last 8 episodes talking about, the explanation, communication and patient understanding, they're not just part of the treatment, they effectively are the treatment. So, where does all of this leave us? As we come towards the end of episode 8, how do we summarise all of this? And how do we ensure that the message at the end is clear and concise? Because these episodes have taken the idea that pain equals damage and shown that it doesn't always work like that. We've looked at what normal pain actually is, how it's produced, why it's produced, and the importance it has as a protector. Now, then we introduced how over time it can change. We've seen that pain is real, but it doesn't always reflect what's happening in the body. That the body and the nervous system are constantly working together, interpreting information, making decisions, and sometimes becoming more sensitive in the process. And that sensitivity can be influenced by a wide range of factors. It's not just what's happening in the body, pain is usually influenced by more than that alone. And that's what makes this complex. And it's also what makes it difficult, because there isn't one single cause and there certainly isn't one single solution. But that complexity is also where the opportunity lies, because it means that there are multiple points where things can start to change. Small shifts in understanding, small changes in behaviour, small adjustments in how we approach things day to day. Individually, they might not seem like much, but over time they can start to influence how the system behaves. And that's the key idea that runs through all of this. We're not trying to switch pain off, we're trying to change how the system responds to it. And that starts with understanding. Understanding what pain is, understanding what influences it, and understanding that it can change. This isn't something that only applies to small groups of people. This applies to everybody. Because most of the time, pain does make sense. If you injure something, if there's irritation or inflammation, pain is doing exactly what it's supposed to do. It's there to protect you, to make you aware, to get you to respond. And that's how nearly everyone experiences pain at the start. It comes on for a reason. It behaves in a way that fits, and it's managed as that type of pain and disappears as we would expect it to do. What people don't see coming is when the pattern changes, when the original reason settles but the pain doesn't follow the same course, or when it starts to behave in a way that no longer quite adds up. And that's the point this podcast has been focused on, not replacing the idea of pain as protection, but recognizing when it stops behaving like that, and having an understanding of what makes it easier to spot when that shift has happened, and to help approach things differently when it does. So if there's one thing we can take from all of this, is that pain is real, it's often complex, but it doesn't mean that something is damaged. This podcast has been about helping you understand that, because this understanding can help people recognize when pain is following a different path or begin to change how they interpret it if it already has. What this podcast is not saying is that if you do all of these things, your pain will disappear. This is the first stage of the process, the education, the understanding, and applying some of the information to your own situation, starting to change how you perceive your pain. Because taking all of this in is not easy. And there is a big difference between listening to this, say, out of interest, versus listening to this while dealing with chronic pain. For someone whose symptoms have built up over years, 5, 10, or even more than 20 years, this is a very different starting point. So this isn't about hearing something once and expecting everything to change straight away. It's about starting to look at things differently. And people will take different things from it. Some parts will land straight away, some won't, some will feel relevant, and others won't. And that's normal, because everyone brings their own experience, their own expectations, and their own way of understanding what they hear, just as clinicians do. So the process is not just hearing the information, but it's working out how it fits your situation and what you do with it from there. And even with the effort that's gone into explaining this clearly, people will hear it in different ways, and they'll take different parts from it. The parts that make sense to them, the parts that feel relevant, and the parts that fit their own experience. And there's no guarantee that everyone will interpret it exactly as intended, because people bring their own bias to what they hear. So this podcast is not a cure, it's step one of the process, and hopefully a worthwhile one. So this brings us to the end of the series, and I hope you found it interesting and worthwhile, whether it's an area you're simply just have a valid interest in, you're a clinician, or obviously if you're a chronic pain sufferer. The information is not based on my opinion, and it's as close as we could get to completely evidence-based without overreaching on points. I would like to thank people for taking the time to listen, and I've been quite pleasantly surprised by the level of traction it's received from many countries actually around the world. And I hope it acts as a resource for people in the near future, and please share with anyone you feel would be interested. After discussion with some listeners, we're opening up an episode 9, which we are going to use as a way to clarify information. So we are going to invite questions from listeners on areas they would like clarification on, or related areas they would like covered in a final episode. We'll put this together over the next few weeks, so if there's anything you would like to ask around this topic, please put it in the comments, or you can email me directly, and I put all the details in the description box. Obviously we can't deal with individual patient cases, but certainly we can address any questions you may have on the topic itself. Thanks for listening, and chat soon.